How often should cholesterol be checked with hyperlipidemia? Imagine managing your cholesterol levels is like keeping a garden healthy. You need to check on it regularly to see what needs watering or trimming. If you have hyperlipidemia or high cholesterol, knowing how often to check is key to staying healthy. For people with hyperlipidemia who are on treatment, like taking statins or other medications, doctors usually recommend testing every 3 to 12 months at first. This helps see how well the medication is working and if you are sticking to your treatment plan. Once your cholesterol levels are stable and at your target, testing can be spaced out to every 6 to 12 months. If you have many risk factors for heart disease, such as diabetes, high blood pressure, smoking, or a family history of early heart problems, more frequent checks are advised. These individuals might need testing every 3 to 6 months to keep a close eye on their levels. For those with lower risk and stable cholesterol, testing every 3 to 5 years is often enough. This is especially true if your levels have been consistently good and you are not on medication. People with diabetes or metabolic syndrome, which increases the chance of heart issues, should consider having their cholesterol checked once a year. Regular testing helps catch any changes early so adjustments can be made. In cases where triglycerides are very high, above 4.5 millimoles per liter, fasting lipid profiles are preferred. These individuals might need more frequent testing to prevent complications like pancreatitis. The goal of these guidelines is to find a balance. You want to monitor enough to catch problems early but not so often that it becomes a burden or costly. Early testing after starting or changing treatment helps guide adjustments. Once your levels are stable, longer intervals are fine. To sum up, if you have hyperlipidemia and are on treatment or have high risk factors, check your cholesterol at least once a year. When starting new medication or making changes, testing every 3 to 6 months is best. For those with low risk and stable levels, testing every 3 to 5 years works well. This way, you stay on top of your health and reduce the chance of heart disease by catching issues early and making necessary changes.